I think the most important aspect of the metal artifact reduction to rule out or make the diagnosis of a hemorrhage or bleeding close to metal artifacts such as coils has been on patients that become symptomatic, such as have a headache and they come to the emergency room and have we have difficulty to assess if the previously treated lesion has any associated bleeding nearby. And I think in those cases that could be just a small amount of bleeding, the patient is doing relatively well, but new symptoms, it really has given us a lot of confidence to rule out that there was no hemorrhage. We can move on into the workup for other reasons of headache. Another application has been really in an acute setting, as you're doing the procedure and you have any questions that there may be a leakage around or perforation of wire perforation or any type of concerns that were relatively small, that in the past you just could not visualize near the metal artifact area. I think this really increases your level of confidence during the procedure to be able to move on with anticoagulation or with even move on with the procedure and kind of rule out the possibility that there was a small event or a hemorrhage that, and we're talking here a finesse of this. This is not about detecting. It's obvious that we can detect very large hemorrhages with angiography, but this is in a very small level near artifacts such as coils and stents. It's been extremely helpful.